Welcome to Health and Self-Care. High blood pressure, hypertension. High blood pressure is a common condition in which the long-term force of blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Blood pressure is determined both by amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrow your arteries, the higher your blood pressure. You can have high blood pressure hypertension for years, without any symptoms, damage to blood vessels, and your heart continues and can be detected. Uncontrolled high blood pressure increase your risk of serious health problems, including heart attack and stroke. And once you know you have high blood pressure, you can work with your doctor to control it. Symptoms. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds. But these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. Causes. There are two types of high blood pressure. Primary hypertension. For most adults, there's no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, tends to develop gradually over many years. Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause higher blood pressure than does primary hypertension. Obstructive sleep apnea, adrenal gland tumor, kidney problems, thyroid problems, certain defects you're born with, congenital in blood vessels. Certain medications, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs. Illegal drugs, such as cocaine and amphetamines. Risk factors. High blood pressure has many risk factors, including age. The risk of high blood pressure increases as you until about age 64. High blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Family history. High blood pressure tends to run in families. Being overweight or obese. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissue. As the volume of blood circulated through your blood vessels increases, so does the pressure on your artery walls. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. Too much sodium in your diet. Too much sodium in your diet can cause your body to retain fluid, which increase blood pressure. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. If you don't get enough potassium in your diet, or retain enough potassium, you may accumulate too much sodium in your blood. Drinking too much alcohol. Over time, heavy drinking can damage your heart. Stress. High level of stress can lead to a temporary increase in blood pressure if you try to relax by eating more. Using tobacco or drinking alcohol, you may only increase problems with high blood pressure. Complications. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels, as well as organs in your body. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, atherosclerosis. Which can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken, left ventricular hypertrophy. Eventually, the thickened muscle may have a hard time pumping enough blood to your body's needs, which can lead to heat failure. Weakened and narrowed blood vessels in your kidneys. This can prevent these organs from functioning normally. Thickened, narrow, or torn blood vessels in the eyes. This can result in vision loss. Dementia. Narrowed or blocked arteries can limit blood flow to the brain, leading to a certain type of dementia, vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what causes have been identified. Primary hypertension treatment options. If your doctor diagnoses you with primary hypertension, lifestyle changes may help reduce your high blood pressure. If lifestyle changes alone aren't enough, or if they stop being effective, your doctor may prescribe medication. Secondary hypertension treatment options. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on that other condition. For example, if a medicine you've started taking is causing increased blood pressure, your doctor will try other medicines that don't have this side effect. Sometimes hypertension is persistent despite treatment for the underlying cause. In this case, your doctor may work with you to develop lifestyle changes and prescribe medications to help reduce your blood pressure. Treatment plans for hypertension often evolve. What worked first may become less useful over time. Your doctor will continue to work with you to refine your treatment. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common home remedies. Developing a healthy diet. A heart-healthy diet is vital for helping to reduce high blood pressure. It's also important for managing hypertension that is under control and reducing the risk of complications. These complications include heart disease, stroke, and heart attack. A heart-healthy diet emphasizes foods that include fruits and vegetables, whole grains, lean proteins like fish. Increasing physical activity. Reaching a healthy weight should include being more physically active. In addition to helping you shed pounds, exercise can help reduce stress, lower blood pressure, naturally and strengthen your cardiovascular system. Aim to get 150 minutes of moderate physical activity each week. That's about 30 minutes 5 times per week. Reaching a healthy weight. If you are overweight or obese, losing weight through a heart-healthy diet and increased physical activity can help lower your blood pressure. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga or tai chi. These are all proven stress-reducing techniques. Getting adequate sleep can also help reduce stress levels. Adopting a cleaner lifestyle. If you're a smoker, try to quit. The chemicals in tobacco smoke damage the body's tissue and harden blood vessels' walls. If you regularly consume too much alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether. Alcohol can raise blood pressure. Thanks for watching.